There are three areas that I'd like to talk about. One is education. In the last few years, we've really been concentrating on educating radiologists about old screen film technology, but we haven't been converting the education to digital radiography. So one of the big problems that exists right now with digital radiography is educating both the radiologists and the radiologic technologists who use the equipment about what is special about digital radiography and how it varies from screen film radiography. Focusing on that education then gives us a better understanding on how to produce a good image quality, and then you can become aware of the trade-offs between dose and image quality. The next challenge has to do with image quality. We don't know how reasonably low of a dose one can go before we start losing the ability to detect disease. So we may be operating, just 20 or 30% too high, which is okay. You don't want to be at the absolute bottom of the floor. Or we may be operating at even higher points. Finally, we need to create national benchmarks so that various hospitals can compare what they're using with other hospitals of similar type and equipment are using, so that they can say, well, gee, maybe we should be using a little lower dose here, maybe we should be using a little higher dose, or we're just right on where national averages are. There's a lot of work that needs to be done. There's work that needs to be done at the scientific level. We need to fundamentally understand noise properties in images and how noise property affect image quality and the trade-off between dose and image quality so that we can determine what is an effective dose. We need a better educational program so that radiologists and technologists can understand noise and how it affects their visualization of image. And then we can better establish dose. Then we need better development of quality assurance tools so that an individual center can look at what dose they're delivering to the patient and determine if that dose is reasonable or too high or too low, and determine when it's too high or too low what the problem areas are. Is it a type of exam? Is it a time of day? Is it a specific technologist? And then we need to create benchmark national standards. So this is where government or organizations like the American College of Radiology can come in and help by using the information technology that exists underlying the digital images to scan the parameters of technique and dose delivered to the patient into a national database so that we can start comparing between centers. Carestream isn't a unique opportunity. They have a lot of brilliant physicists, and they can help us understand the image quality and develop metrics for image quality. So that's one thing that the scientists at Carestream can do. The applications people can help develop technique charts that optimize the technique charts to be used on patients so they do meet these image quality goals but don't exceed them by too much. So development of technique charts specific for Carestream products would be very helpful. Then they could also develop educational models that could be displayed either on the Carestream website or shared with organizations like Image Gently. Educational models that focus on how to use the products well, how to understand digital imaging, when a technique doesn't look like a good image, what to do to adjust that image to make it a good image, or when you need to retake the image. And pediatric specific applications could be developed